It is also critical to food production in a warming world. The future of energy in combination with quality soil and water set the stage for a dire scenario over the next 10 to 50 years in St. Lucia. This brings us to the issue of food security for the island. This is not a scenario of the future, but a situation of today. According to the Food and Agriculture Organization, food security exists when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food which meets their dietary needs and food preferences for an active and healthy life. Keeping this in mind, in December 2015, the International Journal of Environmental Research and Public Health stated, "Type 2 diabetes is among the leading causes of death in St. Lucia, which has one of the highest diabetes-related mortality rates in the world." Data from the World Health Organization shows trends of the increasing prevalence of diabetes up until 2014. Government has taken steps to reverse these trends, but success continues to be affected by increasing consumption of a poor diet of processed, imported food and less physically active lifestyles. Farmers on the island are growing nutritious foods, but a large segment of the people have little purchasing power to buy it.
Food security, there is food available. If you look at our local markets, there are lots of fruits, vegetables, and so forth, ground provisions. But the problem is access. Many persons cannot afford. Persons would turn to cheaper alternatives such as the rice, the pasta, due to cost. So it's a matter of making food accessible in terms of cost to the public, to persons.
Climate change is projected to reduce St. Lucia's food security unless significant changes in agricultural practices are implemented and sustained. The drivers for crop failures over the next 10 to 50 years are listed as increased frequency and intensity of storms, increasing land and water temperatures, sea level rise and saline intrusion, droughts, and soil and water pollution. These will all have direct effects on the island's local agricultural and fisheries sectors. Already, St. Lucia has a relatively high and still increasing food import bill. Data aggregating 24 items and categories of commodities from UN Comtrade statistics shows total food import increased to $167 million in 2017. High imports do correspond to the need for food by the large volume of tourists who visit the country. For various reasons, farmers find it difficult to compete with the low price of imported food to fill the food demand from both the residential and tourist population on the island. The agriculture sector on the island has basically failed to modernize. There is no ongoing action of significant scale to change this scenario over the next 10 years. There are willing farmers and there are government projects in the pipeline, but agriculture remains a difficult sector to turn around.
As I see in it, the young people are not interested in farming, but I don't know, from 10 years I will be getting older, and I do see the young people getting into farming. It's one thing of seeing the young people not getting into farming, but the reward, what are they going to get from that? So I think we'll have a problem later in life. People will have to export, import, everything.
The results from the declining agriculture sector mirror that of the increase of importation of food. Over the last 15 years, the dollar value of food produced per person in St. Lucia dropped by over 70%. This situation is projected to persist over the next 10 years, leading to a more consistent consumption of even more cheaper imported processed food. Data from the FAO shows that St. Lucians do not consume enough calories to suffice the energy requirements to support adequate health. Over the last 15 years, average dietary energy adequacy dropped below 100%, meaning there is not enough calories to meet the average dietary energy requirements of the population. The shortage of quality nutrition will lead to poorer population health and increased burden on the healthcare sector.
In the past, we were more dependent on what we grow, but now it's so readily available. So obviously, it has impacted our. I'm not going to be. I don't think I have the authority to say that fast foods are causing diseases and so on, or there's a correlation. But I mean, persons are dying at a more rapid rate at an early age than our grandparents used to. So I think our choices of food definitely impacts our health.
In isolation, the shortage of nutritious food around the world and in St. Lucia could cause people to grow their own food and more food on the island. This could be a silver lining result within the next 10 years. Beyond this time, however, combating the effects of climate change is projected to require intense adaptation and modernization in the sector to see fruitful harvests. Crops and livestock will require a specific environment to grow. That is, sheltered from increasing temperatures, droughts, pests, diseases, and floods. It is likely that without government intervention, food production in St. Lucia will be monopolized by local and foreign investors by 2050, and the small farmer would only be a legend. Looking past the next 10 years, and in the aftermath of major natural disasters, St. Lucia's already high food import for residents would further increase.